Okay. Thanks so much for joining us here today. My name is Julie Challoner. I'm the Associate Director here. I oversee part of our accelerated program based at our Worcester campus, and I'm joined by two of my colleagues. I'm going to have them introduce themselves. I'll have Ryan go first, and then Henny.
Hi, I'm Ryan. I'm an assistant director of admissions over at our Boston campus. And if anyone is interested in that campus, feel free to reach out whenever, and I'm happy to answer your questions.
Hi, my name is Henny. I'm a second year pharmacy student at Worcester campus. Originally, I'm from India, so I'm an international student here.
So just to get started, we like to show some statistics about pharmacy and healthcare in general. Healthcare is really growing. The field is continuing to expand. According to the U.S. Bureau of Labor Statistics, a third of all new jobs created through 2026 are going to be in the healthcare industry. So you can feel confident entering this industry that there will be job growth for you, as well as jobs available once you do graduate from a pharmacy program. Healthcare is now one of the largest employer in the United States. So again, healthcare has continued to grow. I think this is especially true since the pandemic. We saw, a laser focus on healthcare and how important our healthcare providers are, particularly pharmacists who maybe before the pandemic, people didn't really have an appreciation for all the things that a pharmacist can do. But since the development of, different vaccines and things like that, healthcare has definitely gotten a spotlight. And then a pharmacist is one of the top healthcare jobs currently. And so again, just to go over again, to return on your investment, pharmacy school is a long, program, whether you choose to do a 3-year accelerated program or a 4-year program, you are putting time and money into that program. You typically can't work full time when you're in the program. So you are, definitely putting your professional life on hold for a little bit. And we do like our students to realize that although you may need to take a step back from the workforce and the earning potential while you are pursuing graduate education, you will have a return on that once you do graduate. So according to the U.S. Bureau of Labor Statistics, the median annual wage of a pharmacist is about $132,000. I would say here in the Northeast, we see a little bit of a higher wage just due to where we are located and the cost of living, but our students are definitely seeing at least 132, if not more. Our students are definitely getting jobs. We just recently had our graduation here last week for our 2024 graduates. I was able to talk to a couple pharmacy students who are graduating. And of the 4 students I talked to, 3 had lined up positions with CVS Healthcare already, right out the door. And the 4th student was matched for a residency. So she was going on to do advanced education. So again, as you can see, those students are getting jobs once they do graduate from our program. We are rated number 3 for return on investment by the Georgetown University Center on Education and the Workforce. And we're a top best pharmacy program or pharmaceutical science school. So again, that time and money and investment that you're putting into your education will pay off once you do graduate from our program.
All right, some additional facts about the school and the program. So MCPHS at this time is much more than just a pharmacy school. You'll notice that we have programs spanning all across healthcare, which we'll talk a little bit more about in a few minutes. But we are actually the second oldest pharmacy school in the country. We wrapped up celebrating our bicentennial last year. So there is a very rich history of educating pharmacists here. You'll notice we also have a very diverse population. We're represented by every state in the US and over 100 different countries among our 3 campuses. And we have over 7,000 total students and a much larger alumni network beyond that. And regardless of the campus, Boston, Worcester, Manchester, you're going to be working with some of the best clinical sites, I would say nationwide. Some of them have pretty recognizable names, which are listed on the screen. But again, all 3 campuses have some really great clinical options for you in some Northeast cities.
So in terms of interprofessional education, all of our campuses, Worcester, Manchester, and Boston, all focus on the healthcare or life sciences realm. So what that means is our students are coming in to complete degrees that relate to that. So some are clinical based. So you are looking to get, a clinical job after graduation. So that would be like a pharmacy program, physical therapy, optometry, sonography, something like that. And then we have other programs that are looking to work in healthcare, but not maybe the clinical side. So healthcare business, health sciences, pharmaceutical sciences, things of that nature. Because of that, it puts us in a very unique position that all our students at all 3 campuses are studying healthcare. which is very different than other universities where you have students who may be studying healthcare, other students who are studying law or humanities or foreign languages, and they don't necessarily have that common thread. So one of the big things here that we like to highlight is our interprofessional education. And again, we're able to do this because everybody is focused on the same discipline. So IPE, for short, provides experiences that parallel the real team-based worlds of health, professional healthcare. Again, when you're out in the real world, you're not going to work in a silo. Regardless of the type of pharmacy you work in, you're going to work with pharmacy technicians, other pharmacists, doctors, nurse practitioners, PAs, you're going to interact with the insurance companies. So again, there's going to be lots of healthcare professionals that you're interacting with. And because we are healthcare focused, we can bring our students and faculties from our different disciplines, schools, and campuses together to kind of learn about their respective fields. So I'm going to turn it over to Henny to kind of talk about some of the IPE experiences that she's had here since she started at MCPHS.
So as Julie mentioned, these IP activities are designed to foster like collaboration among the students from different programs. So during my time here, I experienced not only from our on campus, but we also collaborated with outside from UMass School of Medicine, because our school does not have School of Medicine program. So we collaborated with them as well. And these activities just include case-based discussions, stimulations, or team-based projects like aimed at addressing complex patient case scenarios. And these are also designed to improve your like promote teamwork or communication skills and understanding the mutual respects among future healthcare professionals while you're going to work outside. It's important to like understand the codes of ethics because every profession has different codes of ethics for patients. So through these different activities, we learn to appreciate the roles and perspectives of other healthcare providers and ultimately enhancing the patient care and outcomes through coordinated care.
So some of the things that our students have access to when they come to our campus is, state-of-the-art facilities. We are constantly investing in our facilities. Our Boston campus recently celebrated its bicentennial, but just because we are 200 years old doesn't mean that all of our facilities and buildings and things of that nature are 200 years ago. We're constantly adding in new technologies, updating classrooms, the technology, anything that needs to bring us up to modern standards, and that's across all three of our campuses. We even made some updates during COVID to make spaces much more accessible to our students during the pandemic, easier to clean, things like that. We have a range of professional clubs and organizations on campus. So we have pharmacy clubs that specifically focus on different areas of pharmacy, which could be anything from the national pharmacy organizations to more niche groups like industry pharmacy. We also have organizations that don't necessarily focus on pharmacy itself, but focus on kind of the overall student body, like student government and things of that nature. All of our programs integrate NAPLEX preparation into the curriculum. So this is something that our students do receive during the third year of the program, for the accelerated program, and during the later years in the Boston program. We want to make sure that our students are prepared to sit for the national board exam. Again, we make it a requirement to graduate from our program that you do attend these preparation courses, so that way you do feel prepared once you do graduate and you are sitting for your boards. We have students who go on to postgraduate opportunities. As I mentioned previously, we have a student that graduated from the accelerated program recently who is going on to a residency. We offer different certificate programs that our students can take advantage of. And we also offer research concentrations. So again, there's lots of different things for you as a student here. It really just depends on your interests. I am going to turn it over to Henny to talk about maybe a pharmacy club that she joined while she's been here on campus.
Yeah, so we have many organization on campus, including a national organization like American Pharmacy Association, APHA, which is the biggest organization in the pharmacy. Then we also have American Society of Health System Pharmacists, and then the Industry Pharmacy, Community Pharmacy Organization, and the Clinical Pharmacy Organization. So these organizations are based on the specialty that you want, that you are interested. So when I started pharmacy school in my first semester, I kind of joined all the organization. I used to go in different events that organized by these organizations. This helped me to kind of explore the career opportunities that pharmacy has to offer, because having the accelerator program, I do not have work experience outside in a pharmacy anywhere, or do not have any internship experience. So joining this organization kind of provided me the exposure to the different pharmacy areas that we have. And also it provided me a great opportunity to network outside of the campus. Now, like I do talk to a lot of people. I network with a lot of professionals that work in a different pharmacy fields. And that's how I narrowed down my interest. And like, I'm interested in industry pharmacy. And then I narrowed down my interest in industry pharmacy. Then I joined, I gained the leadership experience by becoming a president for industry pharmacy organization. So this organization also provides you to join the e-board and gain some leadership experience. And through that, you will get to organize such events like health fairs, participate in legislative advocacy efforts that I did through the American Pharmacist Association. And you also host like guest speaker events. And through hosting those guest speaker events, myself and other students also get a networking opportunities and get to know what kind of work they do outside in the pharmacy field. So definitely having these organizations on campus and mainly participating in different activities kind of help you to explore the pharmacy outside on campus.
All right, and as we briefly mentioned earlier, we do have 3 different campuses. So Boston is our oldest campus, again, founded just over 200 years ago now. It's also our largest campus at about 4,500 students in total. It's right down the street from many of the healthcare facilities that you may have heard of in the city. We're in the Longwood medical area. So again, a lot of great clinical options there. Our second oldest campus is our Worcester, Massachusetts campus. So that's centrally located within New England and is the second largest city in New England as well. It was founded in 2000. So again, a bit more recently. There's about 1,600 students in total there. And again, some really great clinical options in more of central New England. And then our newest and also smallest campus is Manchester, New Hampshire. So that is, I would say, one of the more of healthcare hubs of the northern New England area. But it was founded in 2002. It has about 500 students, so it's a little bit of a quieter setting for someone looking for something a bit more intimate and something that you kind of get to know everybody even a little bit better than the other campuses. So again, there's 3 great options. All of them have some really great locations to study and potentially work in healthcare once you graduate. Okay, so to go over our direct entry PharmD program on our Boston campus, we do offer a 6-year program for students that do not already have their prerequisites complete. But for students that do have all of their prerequisite coursework complete already, it's a 4-year professional phase. It's a traditional fall and spring semester. Again, so we do have the pre-professional entry available as well as a professional entry. And then another important note about the PharmD program on our Boston campus is we do have a PharmD specific honors program available as well. So regardless of if you're entering as a freshman, a transfer student, or on the graduate side directly into the professional phase, we're able to accommodate on the Boston campus.
For the accelerated program, we are looking at 2 campuses, Worcester and Manchester. The program is exactly the same at both campuses. They have the same admissions requirements. They actually have 1 dean. We have 1 accreditation. Really, the only difference is physical location. So students who apply to Worcester and ultimately decide to attend that campus would do classes in Worcester, and the same thing in Manchester. It is 2 years of it's 2 years of an adapted classroom-based learning and then 10 months of advanced rotation. So a little bit faster than that 4-year program in Boston. The reason being is that we do offer 2 summer semesters during the accelerated program. So you don't have your entire summer off like you would in a 4-year program, which is why we're able to offer a shortened program there. We are professional entry only. So unlike in Boston, where you can come in and do some prereqs if you're missing some classes and then move into the professional phase of the program, for the accelerated program, you must have all prereqs completed prior to entering the program. There's no way for you to do those prereqs while in the program, as again, since we are accelerated, we are focusing only on pharmacy coursework, and we need our students to have a basis in other sciences prior to coming in. Now, one thing I like to highlight is that regardless of the program that you're interested in, definitely reach out to Ryan and I if you have any questions between the difference. It can be a little confusing between the names and the different campuses, and we're happy to help you and potentially direct you to the right program for you, depending on your educational background. So in terms of clinical experiences, both programs offer clinical experiences, and you will do IPPEs and APPEs in both programs. So your IPPEs are your introductory pharmacy practice rotations, and you'll do two, one in community, which would be like your CVS, your Walgreens, pharmacy, independently owned pharmacies, something like that. And then one in institutional, which is typically in a hospital system. You then go on and do your advanced rotations towards the end of your program, which are known as your APPEs. And as you can see there, there's 6 of them listed out as well. We do have rotation sites for everybody. Nobody is responsible for going out and finding their own rotation sites. For the Worcester and Manchester programs, typically you're about an hour, within an hour's drive of your home campus. If you'd like to stay close to home, it could be, it could be closer. We just can't guarantee that you'll be down the street from campus. And for Boston, it's very similar. You're within the greater Boston area. However, if you're interested, you can go further afield outside of those areas. There are some other sites available, but we're not going to make you go to California if you are not interested in doing so. The other thing I like to highlight is for the accelerated program, it's very similar. We typically don't send you to Boston unless you ask to go to Boston, just due to the nature of the commuting there. And very similar, if you're in Boston, you're typically not commuting all the way out to Springfield, Mass, unless, again, you opt for a site that is out there. So you're kind of within your home base there, depending on the campus, which could affect, which campus you're interested in, depending on your where you're currently living and what you're thinking about as they enter school. So Henny has actually completed her IPPEs as she is a second-year student here in the accelerated program, and she actually will be getting ready to go out on her APPEs. So I'm going to turn it over to her to provide some information about rotations from her point of view as a student.
Yeah, so as Julie mentioned, these rotations are in the various areas of pharmacy practice, including like community, institutional, ambulatory care, internal medicine, and 2 are the electives. I finished my EP rotation, which are the introductory. So basically during these rotations, I had an opportunity to work with licensed pharmacists to gain hands-on experience in medication therapy management, patient counseling, drug information provision, and interprofessional collaboration, meaning that when I was in my institutional rotation, I used to go on rounds with the pharmacist that I was working with, and I had an opportunity to look for the patients, communicate with the patient, counsel them, and also collaborated with the doctors and nurses on different patient cases. For the community rotation, for both rotations, you have to do 40 hours per week. And these rotations are each rotation is for 4 weeks. So during these hours, you get to learn whatever you learned in the classroom, you apply on the real life pharmacy setting. So it was a great experience for me because I never had a work experience before these rotations, and I had to learn a lot about whatever laws of pharmacy laws that you also learn in the school, you apply in the pharmacy setting. So it was a great experience just knowing that whatever I learned in the classroom, I could apply in the outside setting. And with the real patients. And these preceptors are a great resource for you as a student as well to learn more about the outside world.
All right, and how to apply. So if you're looking to apply to the pre-professional phase in Boston, it's very simple. You just go on our website. But for anyone that's looking to apply for professional entry to any of the 3 campuses, you'll apply through PharmCast. If you're not familiar, it's just pharmcast.org. You can go and check it out. But PharmCast will want you to submit a few things, and we require a few things to be submitted. So we will need you to send PharmCast official transcripts from any college you've attended. If you've attended, 3 or 4 universities, you'll submit all of them. For any international transcripts, you will want to get them translated and evaluated through WES. or a similar company, but West is generally preferred. We do require at least one letter of recommendation with your FarmCast. Now you can submit more. We take a holistic approach to all reviews. So if you submit more, we'll review more. If you want to put 2 or 3 in, that's awesome. They can be professional references, academic references, one of each, whatever you think would be most helpful for you. There is a personal statement of 500 to 1,000, to 1,000 words. The prompt is on FarmCast, but essentially you'll just kind of go over, what's led you to want to pursue pharmacy and why, you feel like you have a passion for it. For any students that are non-native English speakers, you may require an English language proficiency exam. Now, there's a bunch of different ones that we potentially accept, and they all have various scores. The best thing to do is either check on our website. There's a whole grid of which ones we accept and what scores you need, or reach out to a counselor like Julie or myself, and we can, let you know your options there. And finally, it's important to note the PCAT's not required. So if you were planning on taking that for, applying to MCPHS, you don't need to. So yeah, that's all you'll really need for materials to be submitted for professional entry.
So in terms of admission details, for fall of 2024, the application is still open. June 3rd is our deadline, so it is rapidly approaching. So if you are thinking about fall of 2024, I would encourage you to apply as soon as possible. FarmCast does typically give you a little bit of leeway after the 3rd to submit like your transcripts and your letters of recommendation, but you do need to submit the application itself by that deadline. If you are thinking about fall of 2025, the application will open on July 11th, 2024, and we'll start reviewing applications, shortly after that date, towards the beginning of fall there. What we look for in terms of competitive applications is we're looking for your overall GPA. So we're going to look at your cumulative GPA, your overall science GPA, and then the prereq GPA. I will say that we do use FarmCast GPAs. So if you've attended multiple schools, FarmCast will calculate, all the courses that you've taken across different schools for cumulative in science GPA, or even if you only attended one institution, but you repeated a course or two, they're also going to add in those repeats back into your GPA. So just keep that in mind, as sometimes students don't realize that, particularly if your school did grade forgiveness or anything like that, the GPA on your transcript may not match your FarmCast GPA. We don't have a minimum GPA that we aim for, so I wouldn't stress necessarily about that. We are going to look for trends. So again, we'll look at overall GPAs. We're going to look at where did you go to school in terms of do you have a bachelor's degree? Kind of what were your course loads like, a whole host of different things in terms of your academic potential. And then we're also going to look at, experiences that you had. So do you work as a farm tech, or are you working in the medical fields? Even if you're not working in those fields, definitely list out any experiences you have. This could be leadership roles that you've held in clubs and organizations as an undergrad. This could be even if you just worked part-time as an undergrad, and something that's totally not healthcare related. It really helps tell a story and helps us see, like, what were you doing while you were completing your academics, particularly if you weren't taking classes full-time, but you were working full-time and doing classes part-time. All of that is really helpful for us as we start to look to make a decision. We also are going to look at your personal statement as well as your letter of recommendation. All of this kind of gets you to an interview component, and then you interview with members of our faculty here at either the Worcester, Manchester, or Boston campus. Faculty interviews are by invite only. Typically they're virtual. We have had sporadic on-campus interviews throughout the fall 2024 cycle, but most of the time they are virtual just for convenience purposes. So they'll be here on Zoom like we are right now. And there is a writing sample that goes along with the interview. You would get more information about how that writing sample works and how the interview works once you were invited and had picked a date. The one thing I want to say about interviews is, yes, we are in a virtual environment. So you definitely want to make sure that prior to your interview, your Zoom works, your microphone works, your camera works, also that you're in a quiet space. It doesn't necessarily need to be, your bedroom or something at home, but definitely make sure you're in a quiet space. So that way our faculty can hear you clearly and you can hear them and there's no distractions in the background. So definitely keep that in mind. Prereqs vary slightly by program. So as we're going through the prereqs, definitely make sure to look at our website, as the accelerated program and the Boston program have a slight variation in prereqs. However, everything else is the same. We do require a grade of C, not C- or higher. Courses can be in progress or missing. So if you're thinking about fall of 2025, but you're still in school, you can still apply if you're taking courses or you have plans to take courses. That's fine. We'll still consider your application for that cycle. We do accept CLEP and AP options, and then we do have a 10-year limit on math and science courses. We do evaluate any courses over our 10-year limit on a case-by-case basis. So for example, for fall of 2024, we typically would not accept classes taken before the fall of 2014. However, it's not a blanket policy. There's a lot of different factors that go into that. So if you do fall into that category, I would still encourage you to apply because, you know, there's we would need a completed application before we could give you more information. So definitely don't count yourself out if you do fall into that bucket.
All right, and about financial aid and you know, different scholarships that are possible. So all applicants are automatically considered for merit scholarships at the same time they're considered for a decision. So there's nothing additional that you have to do to be considered for a merit scholarship. We will automatically do that just by you applying and submitting all your materials. I would recommend applying as early in the cycle as possible. Typically there is, you know, more merit scholarship money available when you're applying earlier. So there, you know, is still scholarship money available for this fall. So certainly apply, but if you're thinking about applying for like fall 2025, you know, try and apply this upcoming fall and apply early on so that you can hopefully have the best shot at the most merit scholarship money possible. I highly recommend for any students that are eligible to submit a FAFSA. I know, you know, maybe in previous years, it might have been a little bit long, you know, depending on your qualifications, you know, your awards could have varied, but it has changed from past years. It's a bit simpler to fill out. It should not take you too long. And they've also, I believe, adjusted the formula a bit. So I highly recommend filling that out and seeing, you know, what other types of aid is possible. It really gives the fuller picture of, you know, again, all the different avenues that you can utilize to potentially finance your education. And then once you have all of this information, once you have your decision, your financial aid package, or, you know, potential merit scholarship, we're more than happy to sit down with you and go over all of this to make sure that the finances do line up for you. So usually we just do them in, you know, 20 to 30-minute virtual appointments over Zoom, just like this. I mean, we could do them in person too, potentially, but this is a pretty convenient option for a lot of students. And we're more than happy to break down the numbers for you so you really understand, you know, what you're getting into. I know there's a return on investment, but again, we do want to make sure it's very clear, you know, what the cost is going to be for you specifically after all of your aid. All right, and then for anyone that has any questions, feel free to type them in the Q&A. You should see that if you go down to the, I believe, bottom of your screen. But also, if anyone has any questions going forward, maybe you don't have any right now, but you have some, you know, later this week or in the future. Depending on which campus you're interested in, you'll see the contact info for the counselor on the screen. So again, Julie helps out our Worcester applicants. Our colleague Courtney typically works with our Manchester applicants, and I usually work with our Boston applicants. So feel free to reach out to us whenever you have questions. But if you have any questions today, again, make sure to put them in the Q&A box so we can answer them for you.
Yep, so it looks like there is a question that came through that asked if we accept international credits. So we accept international credits for our prerequisite courses. So again, we have a mix of math and science courses that need to be completed. So if you majored in something back in another country, we would evaluate those international credits. If you have an international pharmacy degree, we don't actually accept pharmacy credits. So yes, we will accept, like if you took chemistry or you took biology and it can satisfy our chemistry or biology requirement, we will certainly accept those prereqs, but you would still need to do the full length of the program, either 4 years or 3 years for the pharmacy specific coursework. We don't accept foreign credits there. And just across the board, so people are aware, we don't really accept transfer credits at all for the professional phase of the program. So this isn't necessarily geared towards international students who have a bachelor's of pharmacy and are trying to transfer in credits. We also, if you attended another pharmacy program for a semester and wanted to transfer in credits, we also don't accept those credits as well. So it's kind of just a blanket policy across the board. They want to know if they can submit a TOEFL deadline score after the deadline. Ryan, for Boston, you guys accept that, correct? As long as the application is in by the 3rd, you would accept a TOEFL score after the deadline.
Yeah, so I mean, TOEFL is one of the exams that we accept, and as far as being after June 3rd, we can accept that. I would say try and get it as soon as possible, as we will need it before getting you a final decision. But for some students that are submitting applications, close to June 3rd, their interview process might go a little bit beyond June 3rd towards even late June. So as long as it's in by the time that you are interviewing, there's really no issue there.
And same thing for Worcester and Manchester. We would accept the score after that deadline as well. We'd probably reach out to you to kind of get a feel for when you would be expected to complete that score and things of that nature. If you are a true international student too, we do have an international team that works with international students. We can also get you in touch with them as well. Just to see if we have any more questions come in, I'll just turn it over to Henny. She just wants to answer why she chose the MCPHS program as a student here. That would be great.
I completed my bachelor's degree back in University of Kansas. So I was, being an international, I was looking for something that I can utilize my summer breaks, and Worcester campus offered accelerated program, which is like 3-year program. So that kind of fits my options that I was looking for. And apart from that, I also attended this kind of webinars, and I had an opportunity to talk with the students. And from knowing them, like, I came to know about the different research opportunities that I was interested in. So MCP offers great research opportunities with different professors in different areas in the pharmacy, depending on what you're interested in. Currently, I'm doing a research with Dr. Campbell here on our campus for cancer. This, and apart from that, the area also kind of fits well because Worcester is a great city with great rotation sites around the area with the different hospitals. We have biggest UMass hospital here. We have St. Vincent and other. We also have the pharmaceutical industry AbbVie here, and Boston is not too far as well. Boston is like 50 minutes drive from here, and the public transportation. We also have great service from Worcester to Boston. So even if I was looking for rotations in Boston, which I have it during my APs, so it's not that far from Boston too. So it's a great location, great rotation site. So everything kind of fits well. And I was also offered a scholarship, which I was looking for. So my checklist was kind of all fits with MCP, that I loved it. And also I was looking for a school which offers diverse community, which MCP has it. A lot of international students, a lot of domestic students here too. So which I loves it, and I'm experiencing right now, which I'm having a great time.
Great. So it looks like that's all the questions that we've had come through. But again, if you have any questions that you want to ask us offline, definitely feel free to do so. We're happy to assist you. But otherwise, we hope that your application comes through soon.